So, I've officially started classes here in med school, and this is how it went. So, to be honest, I really wanted to upload a video to update everyone about how my week went last week. But as I'm beginning to understand, I'm not able to do that with the schedule that I want to keep if I want to stay on top of my studies. But I wanted to give you an update on how my last couple weeks have been going. And since I officially started my first lectures, I even had my first test. Here's a recap of how things went.
I will be your maestro in education and learning and fun.
I don't know, wasn't feeling today. So we just had our, we're in our third day of lecture. We just did anatomy with Dr. Basie. It's pretty short, pretty simple, straightforward. Yesterday was a little bit more difficult. So I had my interview with the Education Center where the educational academic support for tutoring and other counseling is located. So I took my personality test, a reasoning test, and another test to see how well I do with studying, exams, and just academic success overall. And I did really well in the reasoning test. I got in the top quartile, which is awesome. It was around 77th percentile, so I kind of felt good about that. And just reconfirmed that my Myers-Briggs is INTJ, so there's some interesting features that I can learn from that designation. I also did a health coaching session where we looked to see if we can grow in our skills of empathy, listening, open-ended questions, summarizing. So I'm headed to my PPM class to talk to a standardized patient and to get a full medical history. All right, we just finished our, what did we do? We just finished our PPM. We took, patient history. Yeah. So introduce yourselves real quick.
Hi, I'm Jennifer.
Cardine, Mauricio.
And we were the group for this week, and we took our full, complete patient history, and it went really well. What do you guys think?
Yeah, we can do better, but
It's a practice, but not bad for a first time.
So we have a quiz coming up, and I am not sure how well I will do on this quiz. It will be over all of the lectures that we have gotten so far, and I'm gonna go study that. All right, so just finishing histology lectures, the last day of lectures before the 4th of July. Our formative exam is on Friday. So it is the 4th of July, and I am headed to the library to study. How you feel you did?
I gotta change my study habits.
I think everybody has something that they need to do.
I'll take notes next time.
Overall,
That's a problem for future me.
we're over-exaggerating a little bit.
So, Meharry is starting this new curriculum, and I'm not really sure how it differs from the old curriculum because, one, I wasn't here in med school 2 years ago, and number two, this is only the second year. So we're still trying to figure out how this new curriculum works, and I think Meharry is trying to do the same. I'm following the material that they're giving in the lectures pretty well, so no problems on that front. However, the one problem that I am having is the scheduling. I'm trying to understand exactly where I'm supposed to be and when. And the only way that I'm really able to keep up with that is the community of classmates. I'm able to follow different information that they post in the GroupMe, and I'm also able to ask them questions if I need help. They have been a great resource, and I probably would not be faring so well without them. So, with that said, here's a little bit of a breakdown as to how my courses are organized. My course schedule is sectioned into 5 parts: Foundations of Medicine, Disease and Management, Principles and Practice of Medicine, Medical Immersion Program, Academic Society's Master's Colloquium and Social Foundations of Medicine. For simplicity, I will focus on Foundations of Medicine, Disease, and Management in this video. Foundations is the basic science and clinical lecture portion of my schedule. Over the course of 2 weeks, we listened to 12 hours of lectures. These lectures were very loosely based on a theme, child dehydration. Along with a clinical study of child dehydration and its causes, we received lectures on topics in biochemistry, fluid compartments and tonicity, histology, which is the study of cells and tissues, cell transport and action potentials, anatomy, and pharmacokinetics. At the end of the first 2 weeks, we took a formative assessment on the lectures. The assessment was made up of 2 questions per lecture for a total of 26 questions. There were additional 2 questions stemmed from medical terminology from our Jeopardy game during orientation week. The overall course is divided into blocks, with 3 blocks occupying each semester. In this first semester, we will focus on an intro into health and disease, then the gastrointestinal system, and lastly, a combination of the integumentary, the musculoskeletal, and then the nervous system. The first block is broken into 2 parts, the formative and summative assessments. Formative assessments are weighed as 20%, and summative assessments are 80% of our final grade. To pass each block, we must earn a 70% on the summative and a 70% on the block overall. So just to recap, I took my first assessment last Friday and I did pretty well. And it seems like they're gonna drop a couple more questions from the quiz, so I think that I'm gonna get an even higher score than that. So overall, I can say that my first 2 weeks of med school went pretty smoothly. So that's all for now. In 2 weeks, hope to give you another update on how school is going. Until then, please leave a comment or subscribe and you'll get a notification on my next video drop. Thanks again. Take care. What is SEDS stand for? Okay. The thing I am most worried about is histology because I'm not sure how to study for this. So that's all for now. So
we all passed, I think. I hope.
You know it's recording. What is my experience?